Sorry about my, oops, hang on, sorry about my graceful entrance there. Yes, just hang on, big snowstorm outside. Yes, big snowstorm. I'm just gonna you. Take my, oh, they shouldn't put, they shouldn't put things so close to the entrance there. Oh boy. I don't think these glasses are going to defrost anytime soon. I'm just gonna put them in my pocket here, and hopefully they will defrost. All right. Very nice to meet you. My name is Nurse Lisa. Yes. Despite what it may look like, I actually do know what I'm doing here. So, anyway, I'm sorry that you have to be in this sort of darkened room. We're having a power outage, and in the hospital here, and in the emergency, we're putting our patients, such as yourself, that are suffering from pain, migraine, so on and so forth. We're placing them in darker rooms. That, and of course, we're running out of space. So I'm glad you're here, and why don't we get started? First of all, I am gonna wash my hands because I've been touching a whole bunch of doorknobs and so on and so forth. So just hang on for one moment, okay? I'll be right back. I just have to wash my hands. Okay, hang on. I'm back. Okay, I'm just gonna dry off my hands here, and then we'll get started. Whew. Okay. So, what is your name? Okay. Yeah, that does match what's on your bracelet. Fantastic. And what brings you to the emergency department today? Okay, right. Okay, so you're having some pain in your ears and also right on the left-hand side of your head. All right, and when did this pain start? Okay. All right. Oh, don't worry, I don't need to take notes. It's all up here. Trust me. Really, honestly. Okay. All right. And is it burning pain, throbbing pain, shooting, stabbing? Okay, sort of a throbbing pain. All right. And on a scale of 1 to 10, how would you describe your pain? Okay, with 0 being no pain and with 10 being the worst pain you've ever experienced. Okay. 7, 7.5. Okay, well that's pretty significant. Well, let's conduct a physical assessment first, and I'll try and keep things relatively short, so we can go on to the physical examination and figure out what the problem is and give you some pain relief, okay? All right. So, first of all, I'm going to check your pulse, okay? So, just your right wrist, okay. Uh-huh. Okay. Well, your pulse is rather thready and quite fast, on the higher end of normal. I'd say about 75 beats per minute. So usually, if you're in pain, your heart rate and your blood pressure will increase as well. I'm going to now just check your blood pressure and have a listen to your heart. Is that all right? Okay. Okay, so just extend your left hand. Okay. Okay, and now I'm just going to put the cuff. There we go. All right, I'll just put the cuff right. There we go. It's not too tight? Okay. All right, now I'm just going to quickly inflate the cuff and measure your blood pressure. Okay, so we have a hair disaster. Sorry. All right, we have a systolic pressure of about 170 and a diastolic of about 70. So it would appear that you are a bit agitated. All right. I am just going to also have a listen to your heart then, just to be on the safe side. All right. Okay. Yeah, just breathe normally. Yeah. Okay, well, your heart rate is quite fast, but you don't have any what we call extra hard sounds. So that's good. Look at my glasses there. Not fogged up anymore, but they are They are awfully dirty. I drove half of the way here with no glasses, so my sight can't be that bad, right? It's gonna be a long shift. All right, any changes in your vision, in your hearing? Oh, okay. You're seeing some spots? All right. Are you on any medications by any chance? Okay. All right. Just look right here. All right. Follow the light. Okay, keep looking here. Follow the light. Okay, pupils fixed, dilated, more so on the right-hand side than the left. That's probably not very good. You sure you're not having any trouble with your vision? No? Okay. Okay, eye on my finger. Okay, follow my finger. All right. You have a little bit of what we call nystagmus, where the eye muscles jittering a little bit. That could be due to the pain. It could be in something with your nervous system, you know. I'm an emergency room nurse. I see a whole bunch of this sort of thing with migraines and anything to do with the cerebral area. Pain can do funny things to us. Very funny things. I'll check your eye movements again at the end of the examination. Okay? All right. All right. So next, I'm just going to put my mask on, and I'm going to do an examination of your ears and your scalp. Have you had any falls lately? Have you hit your head? Have you done anything physically that has happened that would be causing this pain? Do you have migraines? No? Okay. One moment. Okay, I'm just gonna put a mask on, just so I'm not breathing in your ear, and we want to make sure that we keep that area as clean as possible. Okay, I'm just gonna do a visual inspection here. All right. Well, it doesn't look like you have anything sticking out of your ear, and there's no lacerations to your scalp. So that's good. Any history of migraine, headaches, hypertension, stroke, diabetes in your family? No. Okay. Oh, don't worry. I don't need to write any of this down. Like I said, all up here. And I'm gonna wear these gloves as well, in addition to the mask, just to Keep your area of your head that I'm examining to keep it clean. Okay. All right. So I'm just going to start by actually just looking inside each of your ears. All right. All right. Okay. Yeah. Don't make any sudden movements. Okay. You're doing really well. Okay. I'm just gonna look over in this ear again. Have you had a history of foreign bodies in your ear canal? Okay. I'm going to ask you a quick question here, and I know it's going to sound a little bit strange, but it's the only question I haven't asked you so far. Are you under a lot of stress? Like racing thoughts, for example? Yes, and is it preventing you from sleeping? Okay, that's what I thought. That's what I thought. And also, are you feeling a little down? I know during this time of year, a lot of us do tend to, we tend to feel a little bit down. Yeah, it's, some people, I know I'm not making a diagnosis, but, you know, it's called seasonal affective disorder. So I can tell by looking at your ears and, hang on, I missed your scalp, just hang on. All right. Well, so far, what I can see is that you have racing thoughts predominantly on this side of your head, and I can see the blueness and the depression, and sort of that your mood is sort of beginning to head downwards, and I can tell on that side right here, and then right above, right on the top of your head here, on the left hand side on the top. I think that's where your pain is coming from. So I'm going to, I've seen this once or twice in my career. I mean, I've been doing this for about 15 years. It's pretty uncommon, but I'm going to need to remove the racing thoughts and the blueness and of course the pain, and you may not even need any medication. Okay? All right. So I'm going to start. I'm just going to I came in here with my little pair of tweezers. I'm just going to clean these off. Well, we are a rural hospital, so I mean, it's, you know, we're a very small hospital, underfunded, overstaffed, you know. And I'm really sorry if it seems like I've been brushing you today. I don't mean it. Okay. Anyway, as I was saying, we don't always have every tool at our disposal, so I travel with, obviously, with my pen light, and I travel with these pair of tweezers just for occasions such as this. So it was rather auspicious today that I had these on my person. All right. I'm going to put my mask on again. We're going to start over here. All right. Kind of hard to grab a hold of. Oh, that hurt a little bit? Okay. Just take a deep breath. Okay? All right. All right. You're doing really, really well. You see this? That is your blueness. This is what's making you blue, and I'm actually pulling that out through your right ear. Okay, I have there are a few more. Okay, just take a deep breath. You're doing really, really well. Oh, you want to keep these? Oh, well, they're technically considered biohazard, so I'll wrap these up properly for you. Okay. All right then. And let's take a deep breath now, okay? All right. Oh. This the seasonal affective disorder just doesn't want to budge. Okay, this one's better. Again, okay. All right. There's another one. All right, we have 3 more strands left, and I'm just gonna. You're already starting to feel better? Excellent, excellent. All right. There's another one. You're already starting to feel lighter? Really, really good. Okay. Two more. Just two more, okay? That one just does not seem to want to budge. Oh, there we go. Okay. And I think those last two will come out all at once. How are you doing? Okay. I think you're doing really well, and your eyes are looking brighter already. Okay. All right. And we've got the last one. Two of them came out at once. Yeah, I know. It's pretty cool. Now, I'm just going to clean the area out. Just with a piece of gauze here. Okay. I'll just be very, very gentle. Okay. And just quickly have a look here. Sometimes this doesn't want to work. All right. Okay, excellent. I see you have a smile on your face. Right on. All right, now. Shall we now work on those racing thoughts? Okay, I'm going to actually just reassess your eye movements, if that's all right. Okay. Okay, look here again. Follow the light. Okay, follow the light. No nystagmus. Just gonna check your accommodation. Look at my finger. Look at my finger. Focus on my finger. Focus on my finger. Focus on my finger. Focus on my finger. Okay, we'll do it again. Focus on my finger. Focus on my finger. All right. Excellent. Reactivity, accommodation. Excellent. Okay, now I'm gonna work on the racing thoughts now. Okay. All right. Okay. Take a deep breath. Okay. Yep, and again, no sudden movements. All right. So, you must have had these racing thoughts for a long time. Yeah. All right. Deep breath. All right. How you doing? How's your pain? Yeah, we have yet to get to the pain part, but there's another one. Okay. Deep breath. All right. Yeah, you must keep your ears very, very clean. I don't see a lot of wax on these. Okay, deep breath. And we got another one. Well, so far it looks like all of your racing thoughts are intact. That means, you know, we haven't seen a piece of racing thought that has broken off, or any small piece that's been left inside your ear canal. So when we're moving, we got about 3 left. All right, deep breath. Okay. No sudden movements. Okay. All right. All right. Well, we've had one unravel from the other one because this one is actually a lot thinner than the other ones. You're actually looking a lot calmer, a lot more focused on the present. Excellent. So glad when we're able to help people. See if I can get a couple of them at the same time. Oh no, we just got one. All right. And there we go. And this is the last one. Okay, this one's gonna be just a little trickier. Okay, just hang tight, hang tight. Okay. All right. And you're sure you want to hang on to these? Well, it is fairly rare, and now that I think about it, I think that we may take a few samples and send it off to histology, and I don't know, I can see this, you know, fitting into part of a scientific study, perhaps. All right, I am going to just recheck your heart rate, okay? All right, I'm just going to grab this. All right. Okay, just breathe normally now, okay? Okay. Very good. Your heart rate has actually slowed down to about 65, which is at the normal end of normal. There's a smile. I knew it. So I can still see that you have some pain just behind your left eye here. Okay. All right. We're gonna see if we can't get that pain out of you. Okay. All right. Just gonna inspect this area once more. Just gonna clean this off again. Sorry. I know it must seem like I'm terribly disorganized, but I'm really not. And you are feeling better. Okay. All right. I'm just gonna clean this off. Yeah. Yeah, I'm doing good, thanks. Yeah. Thanks. All right. 3 for 3. So we're gonna work on that pain behind your left eye now, okay? So no sudden movements, and just take a deep breath. All right. Ooh, this one's a little bit more. How long have you said that you've had this pain for? For 4 days? Oh, okay. All right. We're gonna send these to the lab, I think, too. The guys down in histology will just have a field day with this, I'm sure. Histology is anything to do with tissues. The study of. This one's a little bit shorter. All right. Deep breath. All right. You're doing very, very well. Okay. Yeah, these ones are shorter. That's actually very encouraging. Very, very, very encouraging. You know, they haven't, the pain has not actually encircled its way right around the back of your eye yet, so it's really good. Ooh. These are, these are stubborn. But they're also intact. So that's very encouraging. Oops, sorry. All right, no sudden movements, deep breath. You're doing really well. 2 more. Just 2 more. So 1. Oops. Yeah, I know this part of the hospital has old water pipes and so on and so forth, so if you've been hearing some clanking of pipes, it's not haunted, I swear. Okay. All right. Oh, that last one just does not want to come out. for a second here. Okay. Excellent. Well, this is the last string of your pain. Gone. Okay, so I am just going to clean this area off. All right. Any pain? On a scale of 0 to 10, it's about a 2. Excellent. All right. Excellent. So I'm going to take care of these. Oh yes. These get sterilized in between patients. No worries. All right, I'm just gonna take a look in either ear again. This one looks really good, nice and clean. Just a little bit of moisture in there. There's no foreign bodies or anything. And this ear here, yeah, there's a little bit of redness, a little bit of irritation. Do you have any pain in this ear over here? It just feels a little sore. We may give you some ibuprofen and acetaminophen, just a combination of the two, just to help ease with that swelling. It's very minor, but I'll have the doctor write a script for you. Yeah, I mean, I thought we were going to need something much stronger, but when I found those threads in there. How are you feeling just overall? Your heart rate is much lower. Your color is better. You're looking relaxed. You're feeling a little bit sleepy, so I don't need to prescribe anything, or I don't need to recommend a sleep aid. Yeah, we did get rid of those racing thoughts now, didn't we? And the pain. So we got rid of the racing thoughts on that side. Oops, this is still on. We got rid of the racing thoughts on that side. We got rid of the pain behind your eye here. And it seems like your feelings of blueness or seasonal affective disorder have effectively lessened. All right. Well, if you are feeling, kind of blue, and if it's getting to be a little overwhelming, you can always come and talk to me or one of the other nurses here, physician. Yeah, and we can refer you to resources in the community as well. All right. Well, looks like we're done here. So what, I could see that you're kind of getting a little bit sleepy, so I'll make sure to get the doctor to write you, write that on your chart, that you need a Tylenol and acetaminophen, okay? All right, so what we're going to do is take this seasonal affective disorder, your racing thoughts, and your pain strings, and we're going to send them down to the lab and leave your information at the front desk. Tell them that you're participating in the histology string study. Maybe we'll give you a call. Yeah, see if it gets published or not. Okay, so I can see that you need to go home. Do you have a ride home? Okay, you have somebody waiting for you outside? Excellent. Good. We just like to check that you're going to be safe. Yeah. Okay, now just follow up with your family physician in, let's say, about a week, and he can just do a post-emergency visit assessment, okay? All right. Well, take care and sleep well. And don't worry, I didn't forget anything. I've got it all up here. I'll write it down in about 5 minutes. Okay. All right. My glasses have defrosted. I'll just have to clean them now. Okay. Take care. Bye-bye.